but I'm glad we got you back on. What I wanted to say is I think the reason that I really like what it is you do is that not only do you have knowledge, but you believe in your knowledge. And I think a lot of doctors don't actually, I think they have a lot of knowledge, but don't believe it or don't do it. I feel like that's why I like the stuff you do, is that you like, I don't know, you just do the stuff. And sometimes it looks complicated, but I was hoping we would work through those complicated things today.
Sure.
But yeah, I think the first thing we kind of need to know are like, what sort of, first of all, welcome to the Anatomy of Therapy. I'm Dr. John Cybulski here with Bobby Riley and special guest, Dr. Zach Kogan today, the sports physio, controversial man out on the West Coast, dangerous in all kinds of ways. But to get into how you treat, because sometimes people will go to the page and they'll see these complicated exercises. And if they don't read below and they just look at the exercise, because you do give some really detailed examples of what it is you're doing, generally people might go, who is this wizard? What the hell is going on? Let's figure out. Because I do think you do know what the heck is going on. And I do think you have some good reasons. But I think Bobby had a good question to kind of start this. Like, who are these people you're treating? Like, what is it you were wondering, Bobby?
Yeah, well, I liked your array of exercises and some of the nuance and complexity in it, but yet you didn't have 1,000 cues. You know, you had specific cues that you were trying to work on in each exercise, as complex as it may look. So I was trying to dig through there from another clinician's point of view and try to pick out, really wanted to know why you would choose such exercises, right? I mean, I get the cues and I get what you're trying to train, but why do you get, where do you get to that selection first? Which made me think, I'm not sure. And the first time we talked with you, we really asked you much about the clients that you work with, whether or not they're mainly an injured population or uninjured. Is it mainly sport performance, or is it a bit of both? I mean, that's really my first question before we lead off.
Sure. Before we even get started, thanks for having me on again, guys. This is sweet. Awesome conversation we had several months ago. So excited to be back on. So it's just to begin with, in terms of population and individuals that I'm working with, whether injured, uninjured, primarily athlete population of professional elite caliber, and not necessarily only injured or uninjured. It's really a nice blend and mixture of all of those different types of things. So unique to my setting as a performance physical therapist, I work in-house with performance coaches as well. So there are times where I'm getting somebody who comes in and a coach kind of will refer them to me saying, hey, they may not have pain, but their mechanics may look off here and there. What do you guys see? More local assessment on the table. That would be an example of somebody who I would be seeing who isn't necessarily injured, quote unquote. You could have that acute hamstring injury, acute gastroc injury, something like that we would be rehabbing back, as well as somebody who's post-op. So there are several different types of clients that we would see within that athlete subset. But yeah, so a good mishmash of everything that you kind of mentioned.
All right. Yeah, I mean, well, with that, I mean, because I saw some overlap. I mean, there's some recurring positions that you really like to train in, whether it's half kneeling, a little bit of RNT type of stuff. You've mentioned, some other active phrases I think John's going to get into. But I mean, so where do you, I guess it's a kind of a multi-level question, which would be where did you get these resources from? Like, how did you come about to learn some of this stuff? But then, how do you lead to this exercise selection? I think a lot of, people follow you, and a lot of people listened to the episode last time with you on there. So I'm thinking, they want to, it looks good. It's kind of like when you're in math class and you're following along with a problem on the board. You're like, I got this. I understand the problem, but the test is slightly tweaked and the variables are slightly different. And then you're like, okay, I don't know how to solve this math problem. I bet a lot of people can see your post and go, yeah, okay, I can see it, because he's laying it out. He's telling me right here, you get this, you cue this, first MTP, blah, blah, blah. But I mean, what is a bit of your selection, methodology? How do you get to the point where how to implement some of these things that you do?
Sure. Great question. So to begin with, I mean, when we're thinking about rehab, we're thinking about our objective assessment and keeping everything extremely objective. So like you said, there's a lot more that goes on behind the scenes, before a video is posted like that. So I have a very good understanding of the athlete in front of me, their movement deficits, and what may be limiting them from achieving their goals on the field, in performance, whatever it may be, what's causing their pain. So identifying those asterisk signs and categorizing those into specific movements that they are required to do on the field of play during their performance. So if we can kind of think about two umbrellas in human movement, and this doesn't even just go for the athlete, this can be for any human being. We have someone who goes for absorbing force, right? How well do they absorb force from the ground up? And how well can they propel themselves forward in space and time? Right? So we have those two different things. And what are the movement patterns that are required for those? Right? What are from the ground up globally, we're looking at somebody, what do they need at the foot and ankle? What types of neuromuscular control do they need? Are they biased more in pes cavus, pes planus, whatever it is? And how can we feed that up and down the chain to provide them with as much foundational control that they need to achieve that with higher velocity movements during more ballistic activities, right? So we're thinking at the end phases of what we're trying to do on the spectrum of rehab, and thinking about how we can progress somebody from a non-weight bearing to a partial weight bearing, continuously trying to load them against gravity with multiple joints approximated, adding on top of each other, and then with resistance, adding without resistance, so on and so forth. You can flip-flop those around depending on what your actual goals are with that athlete. So it's, utilizing our asterisk sign, categorizing into what movements they actually need on the field, and then following those up by progressively challenging the body, lighting up proprioceptors, mechanoreceptors to increase whatever your definition of load is to create the largest change possible.
I'm just curious before John jumps in here, do you
Sure.
find, when you see these guys, and a lot of them are paid good money, they're the top guys, but do you still, in your screening process that you kind of laid out a little bit, we'll call it a screening process, your own
Sure.
method, do you find that they, I'm assuming there's a bit of passive testing combined with active functional testing.
Mm-hmm.
Like in the passive, sometimes if you don't have the passive ability, well, then you definitely can't get into the active point, right? You can't get into explosion if you can't even access internal rotation or external rotation or whatever the
Mm-hmm.
thing is. Do you find a lot of them are already limited on the table or in passive testing first, or do you find that it's a more of an issue with the transition of the capable movements that they have available to them that they're just not utilizing to the highest level?
So I could say that it's certain, there are cases where there are both, right? So just to give you a snapshot of the way that I would typically go about evaluating somebody and identifying these if there's passive restrictions on the table. So typically I would start with some sort of movement pattern, close shape movement pattern after my subjective, right? I'm getting my subjective, I'm identifying what their asterisk signs are, what they have difficulty with, what they have pain with, whatever that is. I want to see what that looks like. I want to see what types of things they feel during that, where they're feeling restricted, where they're feeling pain, what feels good, what doesn't feel great. Can I change their symptoms while their feet are on the ground and they're doing, let's say, a single leg squat? They have they're doing a pistol squat and they have anterior hip pain, but if I can put a towel roll under their heel and bias them into calcaneal inversion, does their pain go away? Little things like that to drive my assessment on the table more locally, and then identifying those passive restrictions on the table. So sometimes we're seeing it, most of the time I'm seeing it in real time and then seeing it passively on the table. But then there are people who don't necessarily, they don't have any true passive mobility restrictions on the table, and it's more so a straight control issue where they can't transition from a load to explode type of thing. Because if you can't load into closed chain triple flexion and you can't wind up your system efficiently, you're surely not going to be able to do it pretty efficiently when you go to propel. So, you know, they're definitely both sides of the coin for sure.
That's and ding, that's the correct answer. 1,000 points to Kogan. No, but what you were talking about, but with, correct. Okay, moving on. You guys are behind. Yeah. That's the correct answer. When you were talking about force production, absorbing and producing force, it struck me, and you were talking about injury or function, that would it be fair to say that you think primarily injury would happen either at their ability to absorb force or create force? So in other words, if you see them in a position where they're trying to create force and they experience their pain, versus a time where they're trying to absorb source and they experience their pain. It was where you're kind of blending your subjective with your objective and then seeing if you can kind of tweak that in the middle. Is it fair to say that injury probably happens at one of those two phases, and their inability within that phase is where your examination goes?
I think it could. I think certainly that's you know, as movement professionals, no one really knows like 100 end all be all.
Right.
You know, as a medical profession, we do that we can, but you know, I believe that certainly plays a large contributing factor to these types of things. Whether it's absorption or propulsion, I believe that if there's inefficient patterning into absorption, so if you can't absorb force, if you can't transition from absorption to propulsion, okay, or if you can't achieve propulsion, right? So if you can't achieve that backside closed chain triple extension,
right,
things can get a little funky. Now, it gets even more complicated than that. So if you really take it to more specific level, with you go to load, and you see this all the time in, like, let's say basketball, you know, someone goes to plant and cut away and to absorb force and then explode laterally away. You see an Achilles pop sometimes, you know, from that absorption, and then it just kind of goes. But then if you think about a hip flexor strain, right, someone's going to be sprinting, right, and let's say just like straight linear movement, they're going to be into backside triple extension, potentially. Maybe there's an extension mobility deficit, but that eccentric control from that front side hip flexor complex, it just can't decelerate the limb as well. And sometimes that mechanism of injury to get that when they have that poor eccentric lengthening from that whole complex. So it could be because of either or. So there's so many different factors that it could happen during each phase or that transition phase from one to the other. It's always like you said, the subjective is huge, and listening to the athlete's story about how it happened, has this happened before, things like that.
Right. So like in getting to like your complicated exercise with the bands pulling in different directions and the positions that these people are in, you found that these positions that they're in have some weakness throughout them. And so to get to these exercises where the knee is being pulled one way and there's a band behind their back, this is meant to correct some of those dysfunctions that you previously found.
I would say exactly. This is meant to reintroduce these patterns to them that they may have difficulty time getting into, creating an awareness of their brain, of their motor cortex, communicating with these patterns, mm-hmm. that this is okay to do, that it's okay to access your hip in this way. They may not be comfortable with that because of past injury, avoidance, whatever it may have been, but certainly trying to light up those patterns in any way, shape, or form to make it easier for them on the field, right? And mm-hmm. it's nice to see this in the setting that I'm in too, because a lot of these guys are going straight out to the field afterwards when I work with them. So you see them do some of the things that I have on video, and then I get immediate feedback subjectively from them when they get done with their movement session that day. Like, oh, I felt great. You know, I was able to I felt way more explosive. I was able to load into my hip more. So it's little things like that anecdotally that I'm able to, okay, you know, let's maybe tweak this here or there. That was great. Let's keep that going. You know, so it's unique to my setting in particular that I'm able to get that good real-time feedback that's going on.
Yeah, go ahead.
If we stick on this idea of patterns, you know, and I mentioned before, I saw some repeat kind of exercises And I don't mean that as a negative. Sometimes I look at that as, in a way, that can be a sign of competence, because patterns, I mean, we know there's capsular patterns, for example, right? We all know capsular
Sure.
patterns. We know that PRI and DNS and FRC and all these people, they're studying patterns. They're trying to show you patterns.
Mm-hmm.
And so my question is, I mean, it piggybacks off my previous question a little bit, but I mean, what are the patterns that you keep seeing in athletes that are repetitive, recurring patterns, asymmetries or inconsistencies? And where do you think that they come from? I mean, I think it was with you on the podcast where I mentioned the book Range
Mm-hmm. I think
back
you
in
did,
April. Yeah, this idea of, Roger Federer, the generalist, versus Tiger Woods, the specialist. I
Mm-hmm.
mean, or these evolutionary mismatches of sitting and then all of a sudden having to go play ball or CrossFit as hard as you can for 2 hours after working at a bank. I mean, where do these patterns that you see, not so much from some of these other lenses of illness and disease or some of the hard injuries that, some of the PRI people see, but in your camp, I mean, where do you, what do you see and why do you think it's there?
So, I mean, as human beings, we can only move in so many different ways. There are only X amount of ways that we can move, and we have a ton of degree of freedom in terms of our joints and the actual volitional movement we have. But when it comes to just human movement in general, from an efficiency standpoint, when I talk about absorption and propulsion, we're thinking about what's happening in closed chain, what's happening in open chain, and vice versa. Whether we're moving linear, lateral, multi-directional, rotational, there has to be some sort of pattern that we're moving through to get into and out of whatever leg is in closed chain, whether it's for a half a second, whether it's for 1 second. There's some way that our muscles on one side of a joint are lengthening, one on the other side of the joint they're shortening and contracting and moving us forward in space. So, to answer your question, there's so many different ways that we can move, and thinking about what sport specifically we're working with in front of us, what pattern they need to get into, and if anything globally is preventing them from getting into this pattern. So, I mean, I can go even deeper than that and talk about specific examples about how something that's seemingly further away in the body can be affecting a joint up the chain or down the chain. But, they're thinking about what a swimmer needs, what a football player needs, what a soccer player needs for a kick, little things like that, thinking about their patterns that they need to get into. How do they load into that and explode out of it? So how can they produce force into the ball? But before they can produce force into the ball, they have to load up some sort of ballistic movement prior to, with principles of plyometrics, so on and so forth. So I'm not sure if that answered your question. There are just so many different ways to go about that, for sure.
Well, if we just stick with the NFL players, for example,
Totally.
or American football,
Done.
if we just stick with the question of patterns, like, do you see certain patterns? I mean, do you
Sure.
see, what do you see? I mean, what's coming in all the time? Because I mean, even me as, in John, where we see the vast majority of pain from all ages and backgrounds and everything, there's still patterns. You can still see, oh, they're lacking this, they can't do this. That's why they have one of these 3 type of pains,
Mm-hmm.
I mean, what do you see? Because I think, that's interesting to think about from an athlete's perspective. I mean, we can understand why grandma's hip doesn't move well, but the running back for the Cardinals, he's been moving presumably his whole life. So, why does he have a problem rotating or getting, in and out of a hip?
Yeah. So I do believe one of the Cardinals running backs actually scored on a nice touchdown run today. But Kenyon Drake has been struggling, so I'm not sure what's going on there. But so thinking about, let's think of, say, football player, for example, and a lot of this is so dependent on the injuries that they're coming in with, and their pattern is going to dictate those injuries that they're coming in with, prior injuries. So let's say they've had a history of tons of ankle sprains. Their dorsiflexion is awful. Up the chain, their absorption, because I mean, that's from the ground up. When we're talking about absorption patterning, we're talking about closed chain triple flexion, right? We're talking about tail curl dorsiflexion. We're talking about knee flexion, tibial internal rotation, femoral internal rotation. We're talking about the pelvis rotating over the femur, right, to induce a little more internal rotation of that femur. And we're getting thoracic rotation to that ipsilateral side. So thinking about how up the chain they're going to be able to absorb everything dynamically, and then how can they uncoil to get out. So depending on what you find in that pattern up the chain, you start to see different things as, you know, every athlete goes off your table. You can kind of match people anecdotally. Okay, they're falling into this pattern that they have trouble absorbing load through their body, you know, but at the same time on the other side of the joint, because they have trouble rotating to the right and getting into that right lower extremity, sometimes they're also having trouble getting out of that left lower extremity too, because they're patterning to get into that right side and rotate towards absorption is tough for them to actually rotate away from that backside lower extremity too. So it's, I don't want to say that everybody falls into these patterns, but those are really prevalent things that I consistently see from athlete to athlete. But, you know, thinking about always going back to the drawing board about how this athlete needs to move forward through space and time and how he needs to decelerate through space and time or absorb force from the ground up. And what is the missing link between that and dorsiflexion? And sometimes you can find things that are coupled with dorsiflexion that they need up the chain too. So, you know, if they have poor dorsiflexion, most of the time you can see poor tibial IR. Sometimes if they have poor dorsiflexion, their midfoot control is piss poor. You know, things like that, that are prevalent. But like I said, very specific to the athlete and also specific to the sport too.
It sounds a lot like this series of positions or movements, the midfoot, the internal rotation, the hip over the femur. Those all coincide with a particular phase of gait.
Yeah, correct.
Whether it is, you know, if it's an early phase, then they're let's just say general gait, your foot is landing.
Yep.
And then your leg starts to go behind you and you push off for just normal people walking.
Exactly.
And through that phase from landing or absorption to propulsion, acceleration, pushing off, toe off, there are a predictable set of factors that can be continuous up the chain. So when your foot hits the ground and you start absorbing force, XYZ happens at the ankle, knee, femur, and hip, all the way up to the torso.
Chain reaction.
And through your evaluation, something within that chain doesn't fit. One of these, this is Sesame Street. One of these things doesn't belong here. One of these things is different, right? And it seems that you have kind of this, I'm just hallucinating this about you, but you have this format of gait in your head, this strand of joints that should kind of connect. And when you find one thing that kind of doesn't connect through that chain, you're like, aha, okay, this is one little weakness through what should be dorsiflexion, internal rotation, external rotation at the hip, alternating thoracic rotation. And so once you see that chain so clearly, and I think you do see it very clearly, and a lot of us don't, which is why some of this stuff seems awesome to us, magical. But you see the links through these chains, whether it's propulsion or acceleration. That's the same thing, absorption, acceleration. Propulsion, absorption.
Sure.
Anyways, and you find the weak link. That's what I see with what you're doing. And I assume that one of the weak links would be like around the lateral knee to maintain external rotation through extension or whatever it was through your exercises.
Sure. Yeah.
Is that are you finding those weak links? Is that fair to say?
So that's certainly part of it. Sure. Depending on the plane of motion that we're thinking about, are you guys familiar with the Gray Institute at all?
Yes.
So, I mean, in my opinion, you know, it was nothing monumental. It's basically human movement, but he was able to classify different movements of how we move in 3 planes of motion. And it's, you know, if you really break it down, it's kind of what we learned as movement professionals anyway. So if we're thinking about that idea of chain reaction, there's a course called Chain Reactions and how everything is ripple effect up the chain and down the chain. And we're thinking about, I mean, I'm just going back to what I was talking about from the from the beginning of the question and some of the patterns that I see, one thing that pops into mind is the awareness, and maybe you guys can also talk on this from working from more of a general population standpoint, but especially within the athletes, the awareness of the transverse plane with our feet on the ground, I find is a difficult thing for people to figure out and to feel and to understand what that feels like, to be able to move within that transverse plane as you move forward through space, and how you can utilize that to your advantage to propel yourself or absorb force or whatever it may be. What do you guys think? I mean, we're moving as human beings, we're moving through 3 planes of motion at all time, no matter what. I'm sitting here and I'm moving my arms around. I'm still moving in 3 planes of motion. So what do you guys think about that in terms of when you see your clients move? Do they also have a difficult time from person to person, mostly through the transverse plane? Do they have a difficult time feeling what that feels like?
Well, yeah, I like the question back at us. That's good. I think I was talking to John about this a while ago, where I was mentioning gait. So I watch people walk a lot, and I always preface it with, this may tell me absolutely nothing, or it might tell me a lot, because I can convince myself that I see all sorts of stuff, but we have to kind of match it up with the rest of the tests and everything else, right? But I'm constantly seeing people that don't swing their arms when they walk. And I tell them, you don't really need to swing your arms. And I don't tell every patient, but to answer your question, I'm saying you don't really have to swing your arms, because you don't need to swing your arms, because there's no rotation occurring. They can stay right by your side as you move forward, and ensure there's some off axis kind of movement like you're discussing through the humeral joint where it does wobble, or through the hip, right? Of course, it is doing some 3D motion. But I mean, so many people pin their arms at their side and walk, or they pin one arm on their side and they swing the other one, which tells me they have unilateral transverse plane capabilities, but maybe they can't get out of that position. They're only able to accept one side of their body very well. So, and then again, I tried not to say stuff right away, but then I get them on the table and I try to look at those tests as well. Okay, you have good IR on this hip and you don't have any IR on this hip. Let's look at your rotation. Let's look at your neck. Let's look at, and you try to put the puzzle. I always say, everything you're testing gives you one puzzle piece, and one puzzle piece doesn't tell you anything. You look at the piece and you're like, I don't know, it's green. Like, okay, let's get some more puzzle pieces. Let's check this. Let's check some active tests. You get enough puzzle pieces and you can see, like, oh, the puzzle is a golf course. Like, I didn't know that until I had enough pieces, and I don't need all of them, but I need enough to see the picture. And so just to answer your question, I mean, I can see it in gait. I can see it in the recurring patterns of poor hip extension. Almost everybody that comes in, they can't extend their hips. They can't squat down to the ground. Can't unlock their thorax. They're probably not going to rotate very well. So I would agree with your point, and I would say we see it probably amplified compared to you because of the sedentary nature of people and the mismatch from the past.
Sure.
John?
That's the correct answer as well. That's 1,000 points to Bobby. So I'm far behind. We got Zach with 1,000, Bobby with 1,000. Dr. Cybulski will attempt now to. No, I think you're right. I think the transverse. That's one of the things that I think when you're getting to see athletes, you start to have to think in a transverse way. Which I think is awesome, because that we are 3-dimensional creatures. So if it's not transverse, then you're thinking sagittal frontal. Let's just keep it simple. Like, I don't think there is such thing as moving in one exact plane. It's always going to be a 3-dimensional thing. But people get a little too sagittal happy or frontal happy, rather than being able to kind of transition through all three. And that is kind of where the problem is. But I think the repetition of seeing athletes over and over, your mind has to kind of consider the third dimension. Like, that's just, when I'm talking about injuries with a nurse, she's like, well, I bent forward to tie my shoe and my back hurt. And so if we hear stuff like that as therapists every day, we can kind of get fooled to thinking, oh, she's talking about a sagittal plane problem. When really, yes, it is a sagittal plane problem, but it's because she doesn't have access to the transverse plane to fold and twist accordingly to reach down the tire. Is that?
That's
can
music.
I get is that 1,000 point?
Music to
can
my
I
ears.
catch up?
I don't want to lose this thought, and I want to throw it back. I want to
Please.
punt. I want to punt
Yes.
the ball.
There we go.
But
Good
I want to do it by
conversation.
saying, I want to punt by saying, do you see rambunctious or overzealous strength coaches creating some of these issues? You know what I mean? Like, if you think about the high school, like squat, bench, deadlift as much as you can, bigger, faster, stronger programs, that were given to every high school kid, and at least when I was playing football. I mean, I see some of these things leading to the patterns that you actually now have to chisel them out of. And I'm not trying to throw trainers under the bus, because they do magic things. And I mean, I think it was the Colts strength coach that said the number one reason to strength train is to prevent injuries, right? That is the main reason. But we get caught up in this performance aspect of the gym. And I think, and a lot of times, especially when it's bilateral movements, bench pressing and deadlifting and squatting, which everybody loves, and but doesn't really help you. I mean, none of the stuff I see you do is usually, bilateral squat. It's not two hands in closed chain. It's maybe one. It's not both feet. It's one, and it's a knee. And so, I mean, do you think that this contributes it? Not to throw our amazing fitness coaches under the bus here, but
No, it's a great, I'm gonna not call it fair catch, I'll take it, but it's only it just seems appropriate on Sunday football. So I'm extremely fortunate enough to work with a full performance coach and strength coach staff that has an outstanding blend and mixture of everything you can really think of when we're thinking about how to program a performance and strength program, right? They utilize power lifts to their advantage, our deadlifts, our squats, our bench press, whatever it is, but they're also coupling it with transverse plane movements, strengthening in the transverse plane. So we're hitting all of those different things. And I can speak from experience with the strength coaches that I've worked with. And I guess I'm lucky enough in the sense that I have not run into that type of issue, that there's great communication between parties and what's specific for the athlete, they're able to implement as well. And everybody's on the same page. And it's not just this tunnel visioned, you're just going to go on this powerlifting, maybe Olympic lifting program. And that's really about it for your strength conditioning, because they're also doing movement skill on the field. And those movement sessions, you need to be able to couple with what they're doing in their strength programs as well. So I think that's outstanding from at least my experiences. I do know of stories from people, just, potentially some strength coaches in the high school sector. I'm not really quite sure. I can't say for certain that I know of coaches who do this, but I have heard of stories saying that, there are heavily based strength programs that are, neglecting the transverse plane and just kind of doing these bilateral movements and so on and so forth. But I don't want to throw anybody under the bus if I can't really speak to my own experiences, for sure.
Yeah. And I mean, I think you're giving some populations too much credit here, because I'm not talking about Texas, like big league high school football. Just think about general American football high school coaches. Probably half of them don't know what the word transverse is.
Sure.
I think that's where we're giving them a lot of credit sometimes. And maybe because you are super fortunate with really smart coaches that you work with and a team, but I still would say you probably are still experiencing some of the stuff you're fighting now could have been set in motion years ago, or these injuries that lead to the patterns that you see. I mean, I always think about, I can't tell you the name or anything, but I worked with a NFL player. Well, I'll never forget it, because he told me, in university, he squatted 700 pounds for a big, NCAA team. And that's a big squat. And he was also somebody who had to catch a ball. So this is a very strong person. So, and then he was now in the NFL. And I said, well, what do you squat now? And he said, 350. And I said, are you a better football player now or in college? And he said, hands down now. It's unbelievably different, because that was to the detriment of his power. Actually, maybe he had power, but he didn't have explosive ability. He didn't have speed. He was losing that because of the focus on strength.
Yep.
And sometimes that'll lead to, now you got people that are hurting their backs because they need to squat 700, you know, and even if it did give them on-field performance, it decreases their, you know, their longevity, or they get injuries, you know, that they shouldn't be getting because of these things. And again, this is not a harp on strength training. That's all John and I love. We love strength training, but I want to say that there's a element of it that can, you know, like I said, overzealous strength coaching. And I do think it's changing, you know, as we get smarter people, we got people like you sharing your information for the world to see. They go, hey, well, hold on a minute. What is this stuff? This is not all just, you know, box squats and banded bench. So.
Yeah, no, I agree with you completely. It makes sense. I mean, it all boils down to specificity of training. You know, what are the needs of the athlete? What are the requirements on the field? You know, do athletes move in a pattern that is specific to a deadlift or a squat? They may, depending on the sport, but most of our field sports, you know, people are moving through space while running, cutting, pivoting, planting. You know, they need their whole body to be moving in one, you know, and most of the time they're in a unilateral stance. So, I mean, it's thinking about those types of things and how you can create those patterns and load them up and create the largest changes too. So I think that's, you know, you're probably right. There are a lot of people who I've been working with who their past training principles have been embedding them in this ability, or this lack of ability to understand the transverse plane. So it certainly sounds appropriate to the population I'm working with as well.
For sure. Just to bleed into the next subject, that's really good. What athletes need, what the person needs on the field. Like, people aren't strength training to lift, to squat. If that guy's going to catch balls, run routes, right?
Sure.
You can squat to squat and that's fine. But you said there are things that the player needs on the field. Two of the things I want to get into before we finish this, at least, we can maybe just get one, but disassociate.
Sure.
How is it that I've seen you just use this word a lot and I love it. And it's an interesting concept. I don't think a lot of therapists really get. Why do, in your exercises, you talk about disassociating? What is the benefit of the disassociation that you talk about?
Sure. So before I even go into that, just I have one final thought with the squatting, and, you know, I think it's important to have a strength program that utilizes powerlifting. I think it's important to develop foundational strength, and depending on what form of periodization you're using, where they are in their cycle throughout off season, in season, postseason, whatever it is. So I don't want to say that strength training is bad, but there are, along with powerlifting and lifting with velocity-based movements, whatever principles you're following, I think it's important to follow those up with subsequent unilateral exercises, movement skill, movement on the field. So I think it's a piece to the puzzle, but it certainly should not be the only way an athlete strength trains. So I had to at least leave it with that so I didn't kind of misinform anybody or get any false information out there. So
good example.
Yeah. Yeah, for sure. I lost my thought. You want to just
disassociate? Why is
gotcha.
Athletes disassociating? Why is that important for athletes?
Got it. So let's break down what dissociation truly means. And I actually had a PT student DM me about this. They asked me why I would want to work into dissociation. Wouldn't that be an unstable position for the lumbar spine? You know, because a lot of people see exercises for the lumbar spine in the sagittal plane. They see dead bugs. They see, they see mule kicks. They see whatever it may be, and things trying to, like a bird dog. And I went on to explain, exactly what exactly is dissociation, and let's think about our body as blocks, right? So we have a thoracic block, right? The thoracic cage, and we have the pelvic girdle, right? And we're thinking about how these two entities dissociate from each other, right? And so it's essentially kind of what we were talking about, the transverse plane, how well somebody can coil up in the transverse plane and how well they can feed into one side of their body when we're thinking about the lower extremity and in closed chain movement, and how well they can feed out of that side as well. And when we're thinking about dissociation, what they're using to accomplish those movements too. right? So defining what dissociation is, understanding that it's the movement of those blocks countering each other in the transverse plane, so twisting away, and then thinking about, all right, well, if I'm rotating away, let's say backside triple extension, so right limb triple extension, they're propelling forward. We're thinking about how well they can dissociate to rotate away from that limb, right? And think about that as well. So how well can my thoracic cage dissociate away from my pelvis while my pelvis moves over my femur? So thinking about rotate one, rotate the other, and then getting into external rotation of that hip. So how well up and down the chain, our core musculature as well is kind of where I was going with this irradiation principle of how well we can feed in neuromuscularly this pattern of connecting the dots, kind of like what Bobby mentioned before, connecting dots of up and down the body, utilizing dissociation to our advantage to implement those neural pathways to increase efficiency.
That's a 2,000 pointer. Geez, well done. I mean, like the creation of force and torque requires an alternating, one thing go left and one thing disassociate and go right.
Sure.
One thing go internal rotation, one thing go external rotation.
Mm-hmm.
If they both go, let's just say the femur and the tibia both go internal rotation, and we could get an overstress at the medial knee.
Potentially.
It depends
on what's.
We're spitballing
right, so,
here.
Sure, it depends on what happens to the pelvis, right? Is the pelvis going the opposite way, or is it following with?
Sure.
So it all depends on what's complementing the tibia and the femur above as well, and what's happening at the trunk too, because that's gonna isolate. All right, am I dynamically able to absorb force, or my passive structure is really trying to hold me up? So.
Perfect.
I think it's such an interesting concept for sure in terms about just human movement in general, not even performance, but just human movement, how we move every day.
Absolutely. So go ahead. Bobby's got one. Go ahead, Bobby.
Sure.
Well, just to stay on that point, but use your Instagram. I mean,
yes,
it looks like what really helps you dissociate a lot is your limbs. You know what I mean? Like being able to use your limbs effectively reaches, whether it's a forward reach or it's a rear reach or it's a push off or it's a hamstring pull, right?
Sure.
It's that ability to use limbs to position your thorax or your central nervous system, if you will, like almost your spine in the correct position. I mean, that's why, I like a lot of your stuff because of that. I mean, as opposed to maybe, I don't know if we would say, ineffective or inauthentic positions, like passively putting people in positions that aren't really being functionally appreciated. They just kind of they're not as effective in my mind. So I think I do see with you, utilization of limbs to achieve this dissociation, if that makes sense.
Yeah. So absolutely. And it's exactly what you said, but also allowing, so the limb is super important with dissociation, right? Being able to lock in your hip and extension while you can rotate away from the hip. A lot of the time, so if you take, let's take a half kneel position, for example, right? Or a high split. Let's use half kneel just for example. And the backside limb is locked in extension, right? A lot of the times, if you play around with that position, the dissociation will actually, they'll feel more glute when they dissociate too. So utilizing the movement from the top down to actually feed into that limb to make that even more efficient, right? More central nervous system drive, more neuromuscular activation, and light that pathway up even more. And, I'll make you a bet that if you really play around with it, and I've tried it so many times, if you just have somebody in half kneel and you have them rotate towards the backside limb, towards the side and extension, they feel less glute. They rotate away from it, they feel way more glute. So it seems to me that this is a lot more comfortable position for athletes. They feel it more, it makes more sense to them. And it translates to what we see on the field. And we were talking about before we even got on, before we started recording, about watching slow motion video and stuff like that. People are rotating away from their backside limb. There's no questions about it. And it's this idea of utilizing from the top down and the bottom up, meeting in the middle to meet in the middle, to figure out how well they can pattern into one another, for sure.
Let's finish with this. Meeting in the middle is perfect. I love how you segue these shows for us, man. I don't know why we try to host these things. Kogan gets 1,000 points for hosting his own podcast. Jeez, man, guest and everything. But okay, so back to the middle. Bobby was just talking about limbs. We're talking about disassociation. I think a really good way to kind of cap this off will be to talk about IAP, to talk about this big center piece that should be pressurized evenly, and that these limbs are kind of moving around. So there's this thing where people have been talking recently on the internet about breathing in a 360-degree way, creating pressure in 360 degrees. Yeah, through the IAP. You've talked about it a time or two. How does this kind of IAP central pressure kind of relate to moving around with the limbs?
Yeah.
It's a hard one to finish off with, but
no, it's a great question. It's a challenging concept, and I feel like it's one that I'm still thinking about the best way to utilize IAP as well. But going back to the basic principle of IAP, everybody, if we go through the empty can, full can analogy, and we think about, the weight on top of the empty can will crumble, but the full can has pressure inside of it before you pop the tab open, right? And you hear the carbon dioxide come out. You put a weight on that, the same amount of weight, chances are it's not going to fall, or it's not going to crumble. Same thing with the styrofoam cup analogy. When you blow the balloon up, you can find that one on YouTube. You blow a mini animal balloon up inside of the styrofoam cup. You put a weight on it, doesn't fall, but nothing inside the cup, and it falls. And the idea of is the equal pressure around the edges of the cup or the can, and you take that same analogy and you take it into the actual abdomen itself. And utilizing that, what is creating that intra-abdominal pressure, thinking about from principles, and you mentioned DNS earlier, right? Principles of DNS and the postural activation of the diaphragm, right? So there's EMG studies that show that we can achieve this postural activation. We know that it attaches to the lumbar spine. We know that there is some sort of postural control mechanism that's incorporated with the diaphragm. We know how it can change the stability in our body. We know that it has this inherent neuromuscular integration with multifidi when you can activate the diaphragm the right way, all the way up the spine, found in the cervical spine too. So there's this global integration of systems when we have the diaphragm involved, right? And thinking about how we can utilize that, the concept of creating pressure, not necessarily just through respiration, but posturally, when we go into and out of postures, whether we're absorbing or propelling, and how, going back to PT school, we always learned that, hey, everything our arms and legs move off of the foundation, right? And you should have a strong foundation. The foundation of the house principle. If your foundation's cracked, things above it are something's going to over time is eventually going to crumble, right? So thinking about how we can optimize our foundation and thinking about how we can foundationally move efficiently into and out of each limb. So thinking about abdominal pressure, the synergistic nature of the integration between diaphragm trim versus the abdominis, multifidi, internal, external obliques, and then the counterbalance that the pelvic floor has the involvement with, and then creating that abdominal pressure to then subsequently dissociate out. You're going to provide as much neuromuscular efficiency to the core complex when you have all of those neuromuscular pathways lit up subsequently. Now, there are obviously places in time when an athlete's going to be in a vulnerable position, and it may be difficult for them to do that. And that's one of those things that we want to train into and create that idea of what's going on in their abdomen, recognize they have a diaphragm. It's a rather large muscle, and let's use it.
I love it. That's awesome.
First stab at it.
That's really good. No, I love it. I mean, look, it is a very complex. Once you start to think more about human movement, you learn that there's a lot more to human movement, that it's not like it's super cut and dry. It is a little bit more specific. But there's a baseball player, I believe you had, whose back leg was up and he had a ball and the ball was kind of shaking as he was going through a throwing motion. And we went back to Gait earlier, phases of Gait, and this kind of rotational, like the Gray Institute thing, swing phase from a leg to a swing phase of the arm, like Bobby was talking about. And the thing that connects them, not only the joints, obviously, but the swing phase from one leg to the opposite side arm, which is kind of what you were starting to talk about with thoracic rotation, right? But that abdominal pressure, being able to transfer the force from the ground really through the abdominal to throw that ball. Go over that ball basically exercise. Do you remember the one that I'm talking about? I wish I could pull it up.
I know exactly what you're talking about. So in order to go into that, I'm not going to go too much into it, but you have to at least break down the pitching motion, just because it's such a unique motion in sport and in human movement. I mean, we know as movement professionals and as a sports practitioner, you know that pitching is the most violent movement in sports. The actual forces that are going and torque about the shoulder and elbow are absurdly fast. Basically, we're using our arm like a whip, right? And even though we're getting neuromuscular activation of those internal rotators at when a pitcher's throwing the ball, we're getting a lot of whip forward from force production from our trail limb, right? When we're pitching in that backside limb as it pops into extension. So we're thinking about, you guys ever hear the term opening up too early, right? So as a pitcher is kind of going through their pitching motion, we're thinking about that pelvic dissociation from the trunk, right? So they're popping their hip into extension in that backside limb. Their pelvis is popping forward. And it's kind of almost this beautiful like ripple effect up the chain. Everything's going to follow suit. So if you watch a pitch in slow motion, everything is almost like everything is should be dynamic in nature, but you can kind of think about it as like a passive rubber band effect. As you pop one thing, you're going to get a whole whip and recoil up the chain. So thinking about that specifically, right, he's sitting back. As his backside limb was elevated, he's almost rotating back into that hip and internally rotating, which you watch a lot of pitchers, some of the good ones, when they come into their takeaway, they're balancing on one limb. A lot of them get a little bit of a pelvis over femur internal rotation to load that backside glute up before they go into their stride, and they actually load off that back limb to then go into extension, external rotation as they pop their pelvis forward. And then they're going to get that ripple up the chain. So it's having him go through, he's having a rotator cuff activation device. So his cuff is activated while he's going through, not opening up too early, making sure to feel his hip pop forward and then rotating up the chain. It's not meeting the velocity demands and how fast he's actually moving in real time, but he's going through his ability to actually separate the two entities of the pelvis and the thorax, and then the upper extremity when following through in deceleration from that front side limb.
Perfect. Dude, that is perfect. That's because that's a great example, of, I think, one of the principles of what it is you do. So these exercises, what Zach just described there, is a lot of things in a row. However, that does meet up what the pitcher is doing, the violent action of throwing, but we're just going piece by piece and making sure every piece is there before we add in the actual throw. It's like learning a piano piece and doing it very slowly. You're just hitting the note. There's no real sequence, but you're making sure those notes all go together. Then once you know how all those notes go together, you go out there and you just play. Is that fair?
Absolutely. Yeah, that's perfect. And this just brings up just a final thought on this. It brings up a question that somebody asked me the other day about progression and regression when using these different straps and how you can use these external vectors, and are these more progressed or regressed? And we're thinking about, we want to provide as little feedback as possible to our clients so they can perform this in a gravity loaded environment without any of these cues, but they're there to provide input to the system so that they understand how to move it, then taking these kind of crutches away as they progress through so they understand how to move already, and then so they can do it without any of those external cues, because we want to take those away eventually as time goes on.
Yeah, that's perfect. I mean, we do that in the clinic where you have to start with people on their back and just get them to feel something or start to change something. But then you get them maybe on their side, or maybe get them against the wall, and then maybe half kneeling, and then maybe standing. Because if you only keep them on their back, it probably will never end up changing anything as they get up and move like a human. But there's an order to these things, right? Where you have to follow a certain path for it to kind of build on itself, and they can start to link these things together. So there's a structure to this, whether it's just treating somebody, treating your uncle with back pain or some high level starting running back.
Totally. Absolutely.
Let's finish with this one. This has been awesome so far. I feel like we could go on for hours just with us, but thinking about those watching and listening, and by the way, thank you for doing so. Not you, Zach, not thanks to you, thanks to the listeners. I appreciate you in other ways, but here's the deal. So where you are at, where the way that you look at things, the way that you think about things is very unique to a lot of people. If someone wanted to begin to start thinking like you, I can feel like I can hear some of our listeners are like, man, that dude Zach knows a lot. I don't know if I can keep all that in my head at once. How do we get our foot wet if we were interested in that? Like, what would you suggest?
Good question.
Resources. Give us resources.
I'll give you all the secrets.
You're like the book of Genesis. Start. I don't know. No.
So, I mean, there are so many different ways to go about answering it because it's just such a mishmash of everything I picked up along the way, to be completely honest with you. I'll be completely transparent. A large part of the things that I can speak on are from a lot of the experiences that I've had in my residency and my fellowship, and the discussions I've had with my mentors and about what human movement is, what it is at the level of the athlete and the elite athlete. And I've been super lucky enough to pick their brains and be able to embed that into my own clinical practice and reasoning. I will say, from a pure resource and continuing education standpoint, because something that is tangible for the listener, and not everybody's going to have those types of experiences. If anybody's considering one of those types of things, I strongly recommend it because it has accelerated my clinical reasoning and thought process and my ability to make informed decisions to a whole nother level than I ever thought it would be at. And I think that majority of what I'm able to speak on today is because of that. But from a chain reaction perspective, I mentioned the Gray Institute and their ability to conceptualize things. And it's nothing more than what I learned in physical therapy school about how the body moves in unison through the Gait Cycle. And it was just a way for me to see how to assess human movement in more of a three-dimensional way. So utilizing, you got 3D maps type of thing. You guys familiar with 3D maps? Utilizing the 3D maps lunge matrix to identify missing pieces and missing links and what's not moving with the other when we're, moving throughout all of these different lunges. And if you're unfamiliar, you can probably find some resources on that if you go ahead and type that into a search engine. But that's one of the first thing that comes to mind. Obviously understanding the literature from a EMG and neuromuscular type of perspective and what types of body positions upregulate certain activation of certain muscles. So having a very good understanding of the literature basis for what you're thinking about implementing as an intervention and how that can change your thought process and what you think about human movement as well. I believe that from a continuing education standpoint, it's important to have a very good idea of the basic knowledge of literature out there so you can make informed decisions about what you want to take away from a specific course. I don't take everything away from courses that, they feed me. I like to take bits and pieces of different things and add into my arsenal and, say, I appreciate that, but I'm not really buying into what you're telling me, things like that. So I don't want to say like, it's first and foremost, it's this, or it's this, or it's this. Mm-hmm. It's such a mixture of different types of things. Like we were talking about before, DNS and some of their principles and taking some of that stuff away and implementing to my clinical practice. So it's some of the things that I've imparted from Exos and the company that I'm with currently and some of their ideas about force absorption, propulsion, and thinking about global movement themes and those types of things. So such a mixture and eclectic approach that that question becomes harder and harder to answer as I kind of move forward in my career. Yeah.
It's a good answer though. It was an honest answer, and that's all we can ask for, man. Bobby, sure. Anything before we wrap up, man?
No, I appreciate you coming on again, Zach.
Yeah.
I think the takeaway was take mentorship seriously and take the time to pick a good one.
Oh yeah.
Absolutely,
Mentorship
man.
goes a long way, especially if you're young in your career. I went straight into a residency when I was a new grad, and it changed everything. So it's, you know, it made me more hungry, made me want to go into the fellowship and want more mentorship, and I owe it all to those programs. So it's been able to catapult my brain into thinking down roads that I didn't really think were there. So it's been super, super helpful.
Absolutely, man. I think that's a great thing to end on. Keep your eyes open. The experiences around you every day are going to teach you a lot more than you're going to learn from this podcast. Although you learned so much from this podcast, I know you did. Still tomorrow, keep your eyes open. Experience is a great teacher. Anyways, hey, Zach, we really appreciate you coming on, man. We're going to have to do this again for sure, because now we got more questions. But we really appreciate it, man.
Yeah,
thanks for listening, y'all. Take care.